Hello everyone, welcome to Surgery Medical Coding. Today we are covering the arthroscopy metacarpophalangeal joint, and along with that we are going to learn arthroscopy related to the subtalar joint. So let's get started. So we have CPT 29900 for the arthroscopy MCP joint with biopsy. Okay, so here the physician is going to perform the arthroscopy. Along with that he might perform the biopsy, okay, of the MCP joint. Okay, so that he will evaluate the joint. Which joint? MCP joint, metacarpophalangeal joint. So in what is MCP joint? What it covers actually, metacarpal head along with the base of the proximal phalanx is the MCP joint. So this will be the anatomy. Okay, metacarpal head along with the base of the proximal phalanx, that considered as a MCP joint. So it is commonly called as the knuckle joint. Okay, so it allows finger flexion, extension, abduction and adduction. Okay, so that's the anatomy. Okay, where metacarpal head along with the base of the proximal phalanx is present. So we have the procedure steps. So here first patient is position. So MCP joint is a position for the axis and local anesthesia is administered. Okay, and physician will create a portals where small incisions are made around the MCP joint. Then the arthroscope is inserted. So through the first portal, and he is viewing the joint internally. Next, surgical instruments also he will introduce through the second portal. Next, joint distension, so that he will infuse the fluid to expand the joint, and it will improve the visualization. So he will infuse the fluid so that it will expand the joint space, and then he will improve the visualization. Okay, so next step he will do is biopsy. So he will take biopsy needle or a trocar, he will insert, and then he will collect the tissue specimen from the joint. This completes the biopsy. So after the completion of the procedure, he will remove the arthroscopic instruments, portal sites are clean and pressure dressing is applied. So what are the key coding points over here to learn? So first he will visualize the MCP joint arthroscopically, and he will collect the biopsy specimen for pathology, and then he will do the diagnosis. Okay, so we have the CPT 29900 for the arthroscopy MCP joint diagnostic, in which includes the synovial biopsy. So next CPT 29901 is for the arthroscopy metacarpophalangeal joint debridement. Here 29901, it will describe the arthroscopic debridement of the MCP joint. So here he will remove the damaged, diseased or irregular tissue using an arthroscopic instruments. He will remove the damaged, diseased or irregular tissue. Okay, so with the help of the arthroscopic instruments, so that the joint will function normally and any symptoms related to the MCP joint will be reduced. Okay, so in that case you can quote 29901. So same thing, anatomy here. Okay, so we have procedure here. So MCP joint is position for axis, same thing, local anesthesia, portal creation he will do, arthroscopic insertion, and then after that he will do instrumentation. Instrumentation he will insert, okay, through the secondary portal. He will infuse the fluid so that he can view better. Okay, so after that he will debride the damaged tissue, debris or lesion. Okay, so he will take care to avoid damage to the adjacent healthy joint surfaces. Then after that he will close with the instruments, and tendon attachments are reapproximated if necessary. Then he will close the portals and he will dress it. So what are the key coding points? Here MCP joint is involved, debridement is performing, and he is removing the damaged tissue or debris. So this is the surgical procedure, okay? So 29900 for the MCP arthroscopy along with biopsy if they are doing, you can code this CPT. 901 for the arthroscopy along with the debridement. So here score visualization and remove the damaged tissue, okay? 29901. Next we have CPT 29902 is for the repair of the thumb ulnar collateral ligament or Steiner lesion. So here the physician will do the repair of the torn ulnar collateral ligament of the thumb. Okay. So here it is associated with a Steiner lesion. Okay. So here ligament is actually displaced. So it will not heal properly. Without the surgical repair, it will not heal properly. So surgical repair is mandatory for the ulnar collateral ligament or a Steiner lesion. Okay. So we will see the anatomy here. So it will connect the thumb metacarpal to the proximal phalanx. Okay, so thumb metacarpal phalangeal joint, it will connect the thumb metacarpal to the proximal phalanx. It is stabilized by the ulnar collateral ligament. So it will use UCL will prevent the sideway movement of the thumb. So that will prevent sideway movement of the thumb. So what is Steiner lesion? When there is a rupture of the thumb ulnar collateral ligament, that is a Steiner lesion. So here torn ligament becomes trapped above the adductor aponeurosis. So the ligament gets trapped above the adductor aponeurosis. So here healing is prevented. So surgical repair is required. Okay. So that's the Steiner lesion. Next, coming to the procedure. So here the physician will make incision along the thumb where he will make at the metacarpophalangeal joint. He will make MCP joint. Okay, so he will extend to expose the injured ligament. He will expose the ligament, then he will identify the aponeurosis, adductor aponeurosis, and he will open it, and he will retract the adductor tendon and joint capsule he will expose. So then after that he will evaluate the tear, UCL tear, collateral ligament tear, and he will confirm it as Steiner lesion and degree of the ligament injury. Okay, he will assess the Steiner lesion and degree of the ligament injury. Then after that he will do debridement of the damaged tissue. Okay, and then after that he will do the repair of the torn ligament. So he will create the bone tunnel creation. Okay, so he will make 2 drill holes in the proximal phalanx. He will do fixation points for the ligament repair. Okay, so next he will do the ligament repair. So he will pass the sutures through the torn ligament. Okay, so sutures pull through these holes and ligament he will reattach to the insertion site. Okay, fixation is secured using a button or a similar device. Then he will close. Adductor tendon he will reapproximate. Extensor hood he will repair it, and wound is closed and rest. So that's how he will repair the tear. Okay, so here thumb MCP joint is involved. So there will be a rupture in the ulnar collateral ligament. So Steiner lesion is present. He will open the ligament, repair it. Okay, so how he will repair? He will drill the holes and suture the fixation. Okay, so these are the coding points you need to remember. Okay, so next we have 29902, same thing, same CPT. So how do you will identify? He will expose, assess and debride and then drill the holes, and he will reattach the ligament. Okay, so we have completed the 29900 for the diagnostic synovial biopsy, and we have covered the arthroscopy, metacarpophalangeal joint surgical with debridement. We have covered 29902 for the reduction of the ulnar collateral ligament. Okay, example Steiner lesion. Next we have the subtalar joint arthroscopy. So we have 29904 to 29907. Okay, so here subtalar joint is actually located between the talus and the calcaneus heel bone. Okay, so it is responsible for the foot inversion and eversion movements. Okay, so we have CPT 29904 for the arthroscopy subtalar joint removal of loose or foreign body. So for whenever removal of loose body or foreign body in the subtalar joint, you can quote 29904. So arthroscopic removal of loose bodies or foreign material from the subtalar joints. We will see the procedure. Same thing here, portals are inserted and he will insert the arthroscope into the subtalar joint. He will identify the loose bodies and the arthroscopic instruments. He will remove the with the help of the arthroscopic instruments, he will remove the object, and then after the completion of the procedure, he will remove the instruments and he will close the portals and dressing is applied. So 29904 for the scope along with the removal of loose body or the foreign body. Okay. Next we have CPT arthroscopy subtalar joint synovectomy. So here synovectomy is done in the subtalar joint when there is an inflamed synovial tissue. So physician will remove the inflamed synovial tissue. So here main keyword is excising of the synovial tissue and removing it. Okay, so that is the procedure. With the help of arthroscopy, physician will perform synovectomy. Next we have arthroscopy subtalar joint debridement. Okay, so here damaged or frayed non-viable or excess tissue from the subtalar joint. Okay, so damaged or frayed non-viable or excess tissue if there in the subtalar joint, he will remove that. So how he will remove? With the help of the arthroscopic shavers or cutters, he will introduce with the help of those instruments, he will remove the damaged tissue. Okay, so here 29906 for the scope along with the debridement. So he is cleaning the or fixing the joint. Next we have a CPT 29907 for the arthroscopy subtalar joint arthrodesis. What is arthrodesis? It is a fusion. Okay, so to eliminate a painful motion, the physician will do the arthroscopic fusion, that is arthrodesis. Okay, so here arthroscope is inserted and joint surfaces are prepared and he will remove the cartilage and bone graft if present, bone graft may be placed. Okay, internal screw fixation is performed. He will perform the internal screw fixation. Okay, fusion he will confirm and he will irrigate the joint and portals are closed. So you can go 29907 for the scope along with the fusion of the or the arthrodesis. So here 29907 is for the scope along with the fusion. Okay, so we have came across the CPT codes. So loose body removal, where he will remove loose body or synovium, foreign body. Synovectomy, he will remove synovium. Debridement, he will remove the damaged tissue. Arthrodesis is for the joint fusion. Okay, so now we will check in the CPT book. We have came across the arthroscopy subtalar joint with the removal of the loose body or the foreign body. Next we have arthroscopy with the synovectomy, where the physician going to remove the synovial tissue. Next we have CPT arthroscopy with the debridement, where the physician going to remove the damaged tissue. Here 29907 is for the subtalar arthrodesis, where he is going to perform the fusion for the painful site area. Okay, so we have unlisted procedure arthroscopy. So you have to code this unlisted procedure when a physician is performing any arthroscopy procedure which is not documented in the CPT book. Then in that case you can code unlisted procedure. So that's all for the today's session. I hope this video helped you understand the procedure and coding. So please support the channel by liking, sharing and subscribing. See you in the next class. If you are interested in surgery medical coding, you can fill out the link which I will be sharing in the description, and you can contact me through the mail which I will be sharing in the description. Thank you. Happy coding.